The fact is that it is felt that patients who have high-risk features seem to have a better outcome when a proteasome inhibitor is used as part of their treatment. And in that regard, patients who have a 414 translocation, 17p deletion especially, there is data that the use of a proteasome inhibitor in combination improves progression-free survival. So that is one thing that we do keep in mind when we decide on a long-term strategy for patients with high-risk disease. For patients who have symptomatic aggressive relapse, we do certainly use 3-drug regimens over 2-drug regimens until unless a patient is got a performance status that does not permit us to deliver a 3-drug regimen. And their 3-drug regimens employing daratumumab and Kyprolis are the popular 3-drug regimens that people have used in recent years. Depending on what they have had in their prior line of therapy, there is a number of 3-drug regimens that can be employed. Daratumumab can be paired with pomalidomide, lenalidomide, or bortezomib, and likewise Kyprolis can be paired with Revlimid, Cytoxan, or pomalidomide as well. These are popular regimens that are used depending on the given situation. The regimen of ixazomib, lenalidomide, and dexamethasone, that certainly is a regimen that is now FDA approved for the treatment of patients with relapsed and refractory multiple myeloma. The use of ixazomib has been shown to improve progression-free survival and depth of response compared to lenalidomide and dexamethasone alone. Also, the use of ixazomib has been shown that patients have deeper responses the longer they are on therapy. Ixazomib is a convenient once-a-week drug that is well tolerated. It has few side effects. Some patients complain of neuropathy. Some patients have some GI intolerance to the drug. It is rare to cause rashes. But generally, the 3-drug regimen of ixazomib, lenalidomide, and dexamethasone is not much more toxic than the regimen of lenalidomide and dexamethasone alone. So the 3-drug regimen does offer benefit for patients who desire an oral treatment, not only patients who are older, where transportation may be an issue, but even in patients who are young and are employed, it is very disruptive to their schedule often to have to take off work to come to a doctor's office to get treatment. And I think that in that scenario, the 3-drug regimen of ixazomib, lenalidomide, and dexamethasone again offers a convenient option, because proteasome inhibitors are thought to be the treatment of choice for patients with high-risk disease, such as those who have a translocation 414 or deletion 17p. The oral regimen of ixazomib, lenalidomide, and dexamethasone certainly offers that as an attractive proposition as well.